Hello and welcome once again to Contact Sport. Tonight we're at Noble Savage Tavern in downtown Shreveport, Louisiana on Texas Street. I want to thank Chef for having us here tonight and invite you to come down and have a couple of drinks with us. You know, share your thoughts so we can get you on video, post it on our site, and you can tell everybody you know about it. So check out the site at www.contactsport.me, where you can also blog, you can chat, you can email us your pictures, your videos, or anything else you want to share with us. And with that being said, I'm now going to turn things over to Willard. Willard?
Hey gang, we're back here in Shreveport, Louisiana at Noble Savage tonight talking about universal health care. What do you like about it? What do you don't? We're going to discuss this. Upload all of our comments to, www.contactsport.me. First, we're going to talk about the advantages of universal health care. What you like about it, what we don't like about it. Later you can join on. And then we're going to talk a little bit about, from the other point of view, some of the disadvantages of universal health care. Who likes it, who doesn't, why? Why don't we have it now? Do we have it now? That's another question. So, with that said, we're going to get ready and get started with a little bit of contact sport. Yeah, I'm smoking. That's right, I'm smoking.
You need universal health care.
I need universal health care. I will if I don't have it now.
Let me go ahead and introduce you. This is BP with Contact Sport, and I'm sorry, your name again?
It's Gary.
Gary. Good to meet you, Gary. And Gary has a real good perspective that I think is worth considering on the universal health care issue. So you'd mentioned you have a couple of companies that are in Canada.
Correct.
And you were speaking with one of the young ladies you have working for you there? Or?
No, stranger.
Just a stranger.
In Toronto,
okay.
yeah.
In Toronto, okay. In Toronto, it's a nice city. It's a
great city.
Yeah, very clean, very, people are nice.
Very metropolitan.
Yeah. So this girl was telling you about her father having a terminal illness?
Some kind of a terminal cancer. A brain tumor, I think. That's what she mentioned.
Go ahead and light up, man, if you got it. Go ahead and light up. So her father, and you said he was 57 years old? 57 years old.
When he was diagnosed.
Okay. So how long did the time pass before the Canadian government made the determination that they were not going to treat him?
She told me he went into the Canadian healthcare system, and they made the immediate determination that he had a low probability survival rate.
Yeah.
And he was 57 years old, and they weren't going to treat him.
Well, just like so they basically wrote him off.
The government decided in Canada is that you had a high dollar disease, you're 57 years old, you've got a low probability of success, and we're not going to treat you.
Just like that. Well, and it's funny because so often the Canadian model is used when justifying us moving to that type of
that's correct.
system.
Well, that's what all the liberals talk about in terms of moving to socialized medicine. But all the Canadians that want treatment come across the border to the United States.
Yeah.
Okay, Trey.
Yes.
Okay, Trey. Now, difficult subject, but we're going to talk about this forest, and it is a forest of universal health care. This business of those people, some well-meaning people providing health care for everybody, regardless of disposition, regardless of income, regardless of how well or how poorly they care for themselves, to benefit from the hard work of many Americans and giving everybody universal health care. I just don't think it's a good idea. It's not balanced. It's not fair.
I agree. It's not balanced, but here's the thing. It goes to more than just that. The root of the thing is government. What's our government based on? It's about capitalism, people doing for themselves and being able to attain that better life, the American dream. And that's a democratic principle. It's a Marxist value to believe that the government should be in control of dictating who receives what. The notion is totally un-American. It's undemocratic. It's right to the root of the problem.
Well, while the government has its place is not to dictate health care.
Right.
Simply because some Americans have the wherewithal to work hard and make proper provisions for their families, and others don't. Should those hard-working Americans be forced, by means of provisioning for universal health care, to pay for people that don't do what they're supposed to do.
They should not, but the government should. you're talking about on a tax basis, there's a million different other things our government's doing with our tax dollars that can be done away with differently. I mean, you can talk about all the way down to the bailing out of the auto industries. If we're going to step into people's lives and private financial business that much, why don't we put this money towards a helpful cause? And they could talk about the other things, but where do you want to stop? You want to start with healthcare? You want to go towards the auto industry? It becomes socialist after a while. If you wanted to put that in the hands, I'm not saying the people paying for it. I think it shouldn't be done, period. That's the thing with the government, is that once the government gets involved, then the people lose control. We're not a democratic country anymore. That's the problem.
Well, Trey, you made one point that I have to go back to. You said it becomes socialist after a while.
Yes.
It does not. It is socialist from its root to tell people,
But it starts
everybody.
with democratic principles, though. That's the thing. It all starts out with good intentions. It's the wolf in sheep's clothing.
No, it does not start out as democratic principle.
A gift horse.
Democratic principle says you get what you work for. You get what you deserve.
I think
It
that's a
doesn't say
capitalist principle.
that's a democratic principle.
Really?
When we say everybody gets everything that everybody else gets, regardless of how hard you work or how lazy you are, that is not
communist.
fair.
That's communist. And that's why I'm saying it. That's where we do not need to go. I'm in agreement with you on that. That's where we don't need to head down that path. That's why socializing healthcare. I'm not saying socializing. Okay, universal healthcare. Universal healthcare.
It's the same thing.
You can say it is. I think Steve was arguing earlier that it can be an opt-in plan like Barack Obama was talking. Yes, okay, you can do that, but it's the idea of where everything has to fall for that to be done. That's the problem. The barriers have to be broken down.
When you say socialize and universal, it's the same thing. When you say universal health care with options, we have that now. People that can afford to pay for it. People that can afford to pay for it because they have worked hard and done what they're supposed to do can get medical treatment based on their efforts. If somebody has not put forth an effort to put themselves in a position to pay for what they need, does that mean we have to pay for it? I don't think that's right.
No, I don't think it's right either.
We're of the same mind.
Yeah, right. I agree. We're not.
When the $3 aspirin becomes a $10 aspirin, becomes the $100 aspirin.
That's the problem.
How do we stop that?
That's the problem with socializing healthcare as well. Where do where will the prices be jacked up? Universal healthcare, socializing healthcare. Where is it going to stop? The prices are getting jacked up now by insurance companies. Will the government, as they've done when they've stuck their hands in many other industries, you get the Halliburton scandal, Iran-Contra affair, all of the ways that the government, the CIA, anyone has gotten involved, it's worked out bad for the people. There's been more money involved, more corruption. And if the insurance companies, which is private, have it done this way now, how much worse would it get if the government were to take control of it? And I guess that's my biggest worry, is that every time you've had a socialist movement or a communist movement, it's worked out bad for the people. Oh, it started out as a great grand idea. And that's where you start going down the path to universal health care. You put it in the hands of the government. And last great couple models we've had in Russia and Germany, things didn't work out so well. And that's my fear. That's what I don't want.
Here's what I think. I think the discussion of universal health care is a good, bad example. We can talk about it to see how bad it could be if we had it. We don't need it. Universal health care is a farce. You get what you work for. You get what you deserve. You want to put your family in a better position? You work for it and buy them a bigger house. You want to put your family in an even better position? Work for it and buy a summer home or a vacation home. Isn't it the same with health care? You want to make sure your family is protected. You want to make sure their health is preserved. Work for it and get what you pay for.
Don't join the military or become a member of Congress.
No.
Great healthcare plans, people. Great
Exactly.
healthcare. By the government, yes, funded by the government, but look at the restrictions.
But that's a different scenario.
What you have to sign away, you're giving away your governmental property at that point. So the government has a reason to insure you, just as you'd have a reason to insure your car. And that's the idea. Your government. It's working on the dollar. And being it's an aristocracy, right?
Then you should make more money and profit to take care of your own business.
Over how long of a period of time?
Then you should work for it. This is the greatest country in the world. You can work and become a
We're told
millionaire.
it's the greatest country in the world because we're told it is.
Healthcare to your employees.
favor of a program where healthcare would be available to your employees?
Healthcare is available to my employees because I buy my own insurance.
Okay.
It's very affordable, and it's because I choose to. The problem that they talk about the unemployed and or the underinsured
Yep.
is because they choose to buy new cars rather than buy insurance. And the first thing that I did when I got out of college is I bought insurance. I didn't buy a car. I bought health insurance.
Okay.
Because that was the most important thing to protecting myself and my family and my assets.
Sure.
And now the X generation, the Y generation, doesn't give a rat's ass.
Okay.
Well, they don't care because we have facilities like LSU right here in Shreveport. Nobody has to buy insurance.
Well, let me ask you this. Okay, say like preventive health care. You know that now there are studies that show that preventive health care can actually result in increased productivity and make businesses more profitable because employees are better able to care for themselves because they don't make the priority of health care as you're talking about. Can you see it benefiting your business? Would you be willing to maybe pay more in taxes for a healthcare program to make those services available to your employees?
Give money to the federal government to manage anything? No. No. They can't even build a restaurant in Washington, D.C. on time, under budget.
Yeah.
So,
You know, Stephen, when we were talking earlier about some of the positives of universal health care, some of the questions just kept coming into my mind about the necessity for it and upon whose authority would universal health care exist. Now, who gets to mandate, what entity, what person, who gets to mandate universal health care?
It would be the federal government.
Why?
They're the only neutral party out there that can actually impose some sort of mandate like that. If you leave it up to the insurance companies, they're going to do whatever gives them the lowest cost and allows them to make the most money. Now, if you leave it up to state governments, of course, you come to run across the problem of different regulations upon different states and people moving to the states where they can get the best coverage.
Okay, well, that gets me back to the authority issue because the number 10th enumeration of Bill of Rights is that all authority not given to the federal government belongs to the states. There is nothing that says that the federal government has the authority to mandate care for everyone. Am I correct about this, or tell me
Not
why
exactly.
Talk to me.
The Constitution does say, like I said before, that every citizen has the right to life, liberty, and the pursuit of happiness. And
Okay, that's in the preamble, but that's not in the Constitution.
Right. Well, in the preamble.
Right.
And that inherent right to life is a right to live, a right to survive, and without proper health care, you're not able to lead a healthy and productive life.
So would abortion be covered under universal health care?
That's a whole other can of worms there.
It's
But,
life, right? Life. We're talking about life, right?
Then you get into the issue of whether it's the woman's life or it's the baby's life, and where does life begin?
Mm-hmm.
That issue. Does life begin at conception, or does it begin after birth, or depending on what religious faith you are, dictates on when life actually begins.
Mm-hmm. So the Constitution, you think it is? I'll put it this way: it is constitutional for the federal government to have the power to authorize the states and any other entity in the United States to offer its citizens health care.
Yes. The federal government is the agency that should do that.
Okay. Now, where is the federal government in this time of crisis going to get the money?
Legalization of pot.
Legalization of pot, guys.
What do you say?
Where are we going to get the money to do this?
That's a topic for another night.
How can we afford it?
Well, we're gonna have to cut costs in some areas. Obviously, there are areas that we're spending way too much money, and there's unfortunately there is a lot of pork barrel spending going on from different states, particularly Alaska.
Aren't you afraid? Aren't you afraid though that the cost of universal health care would make other necessary services such as defense prohibitive?
No, not necessarily. I was in the military myself for 6 years, and there's a lot that can be done to cut costs in the military without cutting our defense capabilities. There are a lot of programs that are just absolutely useless, and there's a lot that goes into things that the military orders on a day-to-day basis that are just ordered on a wasteful basis.
Okay, let's move on. Another thing I was thinking about is you smoke cigarettes. I do too, guys, so I'm not jumping on them about that. But aren't you afraid that under a universal health care system, certain behavior would become prohibited?
In some aspect, yes. But we do all have our own biases, and if we do want to live a long and prosperous life, there are certain things that we're going to have to give up. I've personally tried to quit smoking twice myself. That obviously didn't work out for me.
And wouldn't it be the government's job, if the government's job is to ensure life, wouldn't it be the government's job then to make sure that McDonald's has to enforce companies like McDonald's to have non-fat burgers and low-calorie meals?
Yeah, to at least provide that option, which for the most part they do provide that option.
And so we won't be able to eat at McDonald's, or McDonald's food won't taste the same, and we'll be forced to wear helmets even if we want to walk outside.
What Canada does actually now is they put a tax on fast food and candy bars and stuff like that.
So we're going to be taxed extra for eating what we want to eat.
Right.
Are we losing our pursuit of happiness here in favor of life?
You can have it. You just have to pay a little bit more for it. It's the same thing with cigarettes. I can have my cigarettes. I just have to pay a little bit more for them with taxes. And
so sin taxes will be behavioral taxes.
And that goes into the healthcare pool. Mm-hmm. And there's part of your money. That's not going to be all of your money that goes for the.
And the government gets to decide what is a sin then.
Not necessarily. It is the government's responsibility to decide what is basically social mores and dictate those popular social mores and turn those into laws.
Okay, guys, I think you've had it. You've heard it here first. The federal government will decide which kinds of rap music you can listen to, because we know that rap music leads to violence in concerts. And and violence leads to bad health. I mean, ask anyone who's ever been in a fight. You're not saying that, Steve.
No,
I know you're not saying that. But for the purposes of contact sport, we have to hit hard here and make the point that Steven says that we're going to have extra health care. We ought to have extra health care determined by our government.
Essentially what he's saying is, if we want more health care, we have to give up some of our rights for it.
We have to give up many of our rights, and if those rights we don't give up, we'll have to pay extra for.
No, I'm not saying we have to give up any of our rights. I'm just saying anything that you want to do, anything that's a vice, anything that's that you do that you know is not necessarily bad for you, you're going to end up having to pay for a little bit extra in the long run anyway. So why not pay a little bit extra for it now?
You heard it, man. Hey, that's it for contact sport on the against side. Now stand by for a little bit more on the for side.
I get to go for.
If I'm understanding correctly, you seem to be addressing two issues. First of all, it's people not making a priority of the healthcare, and then the federal government's inability to manage a program such as that. What if
absolute inability to manage any kind of a program?
What if it were a program similar to what we have now, where the states manage the program or manage the healthcare, but the federal government was responsible for things such as electronic files, medical files, things.
The only thing that you would approach that would ever be efficient would be a mandatory individual deduction from somebody's paycheck, a mandatory payroll deduction for their lack of buying healthcare coverage. See,
so essentially being penalized?
No, not penalize the people who pay for healthcare and pay for their own insurance.
But those who don't pay for additional health care, them having it taken out of their paychecks.
Absolutely.
No, I don't really feel that way, gang. It's just about healthcare. We all do. And the purpose of contact sport is to discuss these different views. Sometimes we disagree, sometimes we don't. We're just here to flesh out exactly what the views are. And you've heard a particular point of view. Did your opinion change? What have you learned tonight?
Well, my opinion is still right. I don't think universal health care is well placed in a modern society. If we lived in a commune, oh, I think it would be a great idea. We don't. This ain't. It's not.
Okay. How are we going to afford life as it is right now without universal health care?
Well, we don't need it. We can afford life without it. You want it. Okay, today I drive a Ford. It's a nice Ford. I want a Cadillac. If I want a Cadillac, I have to stop working like I want a Ford. I have to. I want a Cadillac. To get a Cadillac, I have to bump it up a notch. I have to do more work.
What happens when
I
a
have to
Cadillac
work
costs
better.
increases cost from $80,000 per vehicle to $2.7 million per vehicle in the next 5 years?
That being the case, the cost of living will go up, subsequently wages will go up, and if they don't go up, I have to step it up a notch and be the Superman that I am.
Obviously,
and be able to pay for it.
My friend here, Michael, has not been a part of the United States for the past 8 years, where wages have gone down. So our system right now is built upon wealth going to the top, to the few, and wealth is aggregating at the top. The rest of us must suffer declining wages.
Well, you know, I understand what you're saying, and I'll go back from the Ford and Cadillac scenario to you get what you pay for. Well, let's change that. You get what you pay for, you pay for what you want. If you want good health care, you'll pay for it.
Well, that's the whole
If
premise
you
of universal
understand-
health care.
if you
We
let me
all
finish.
contribute to a
If you
little
let
bit of
me
something.
finish.
Jump in there.
If
We
you-
all contribute to a little bit of something, and that is what universal health care provides everyone.
And I think that should be done. While I think that should be done, if you want more than what's provided for everybody else should get something.
Why should
Let them have something. But if
companies
you
be
want
saddled
more,
with the burden of providing health care?
they shouldn't. If the man wants more,
But they are.
If
Instead of
they
companies,
shouldn't.
just make everybody
But if
work.
the man wants more for his family, we eat chicken every day. But if we want steak, I have to make steak
What happens
money.
when that steak, again, you're going back to the metaphor of what individuals want. What happens when that steak costs 2,000% more than it does today?
What if you want the steak?
I go to
And
work.
your pay
I go to
doesn't
work.
rise equivalently.
I go to work and make sure my pay rises. I get a different job.
But at
I do
$10
whatever
it's
I
like
need to
$20,000
do
medical
to
procedure.
get what I need to get for my family.
What do we do?
Cost a year's pay.
What do we do with rising costs of medical procedures? How do we stop the growth of cost?
You know, prices always go up, and they will always go up. That's why wages go up, and they will always
The
go
wages
up.
have not gone
If I made in 1960 what I made now, I could afford 10 times as much. Wages went up, cost of living went up. That is incentive to make more money.
The problem
if you want to do better, be better.
No, it's more than just inflation. The problem is that wages aren't going up because we don't have universal health care. Companies are forced to spend their money and resources on providing
Wages are
health
not
care.
going up for people that don't work for more wages. You want more wages? Do something else. Get greater education. Learn to do something that is marketable.
The cost to the
and get money
company
for it.
remains, regardless of which company you work for. The cost of the company of healthcare continues to exist.
You have
if
it
you
all wrong.
decouple,
Companies don't get sick. People and families get sick.
what is a
If
company
people-
other than the people and the products
If
they make
people
and
and
the
families
services
get
that
sick,
they provide?
the wage earner should make provisions for his wife and his children. And if he doesn't, I'm so sorry for them.
You're sorry for them?
Yes.
Responsibility to care for a family.
Because, and here's why I'm so sorry for them. I would like to take care of every poor soul in society.
You
But
know how
can't-
wages can
but
go
can't
up,
I can't.
You know the greatest
Less below the time to be full-time and be required for benefits. What about things like
the
that?
greatest way to increase wages is to decouple healthcare from the company's expenses.
How about increasing wages by working a little overtime?
Who's going to afford
Getting a
that?
better job.
The companies already are forcing people to work 4 days a week.
I
They're
don't
trying to
want the
limit costs.
I don't want the company to take care of the person. The person takes care of the person.
But that's not the way our system is based right now. Healthcare
I'm
comes
sorry.
from the company.
I'm sorry.
Healthcare does not come from your church. It
I'm
doesn't
sorry.
come from your local bar, your local hospital.
I thought I took care of my family. I thought I brought home the bacon for my wife.
Your bacon is the reason your family is sick.
I thought I was. That's cute. I thought
Stop
I
eating
was,
those high-calorie fat
I
diet.
thought I was my son's hero. I thought I was the protector and provider of my wife.
Your son
If
gets a
they
broken arm,
need
you're gonna fix
I'm
it?
gonna take care of it.
All right, then.
Whatever it takes, because
Hey, guys.
that's the American way.
That's contact sport. Michael and I have a certain opinion. We all have opinions about universal health care. We all have opinions about numerous things. That's why we talk about these things, okay? You join into the discussion. You tell us what you think about universal health care, whether bacon is good or bad, or...
Even if your associate is a good, bad example, listen to him and help him appreciate what you do.
All right. Ciao.
You're addressing three issues: people's not making the healthcare a priority, the federal government's inability to manage any program, and industry's mismanagement of its portfolios.
No. I would say industry's mismanagement of their portfolio.
I mean specifically the insurance industry, and that's a very broad reference.
They bought it cheap, and the companies gave it to them cheap. But somebody had to pay for it. See,
Right,
somebody
exactly,
had to. But the private insurance and the small businessmen had to pay for it.
There you go. So it gets passed down to
Somebody
small
pays for
businesses,
it.
right?
Okay, so the guy with General Motors, and I don't want to use that.
That's fair enough.
Okay, but the guy with General Motors is paying nothing for his insurance, and his family's insured for the entire year for a $250 deductible, single pay.
Yep.
Walks into the doctor's office one time, pays $250, and his health care is paid for. And that sprains, broken arms, babies.
Yep.
I worked for a Fortune 500 company when I got out of college, and they had one of those policies. And my wife had a normal delivery with a normal baby, and I figured it cost me $18 out of pocket.
Wow.
That's in 1975. That's ludicrous. Well, somebody was paying for that.
Right.
Okay. That's ludicrous. It's not even real.
Well, let me ask you this: Do you feel like? I mean, this is just objectively, as a business owner, as someone who benefited from the scenario you're talking about, where you only paid $18 for your child to be delivered. Do you feel like you've contributed to the problem?
It's a lack of regulation on the insurance companies. It's not the federal government getting involved in, but now we have a different situation. We have portability of insurance. We don't trap people into employment. Okay. I was trapped into employment. I couldn't leave my job. I couldn't leave my insurance because nobody would insure me. I was uninsurable.
So based on what I'm hearing you say, when you have the federal government taking one position, and you have the needs of the people, and you have the insurance industry acting as
A god.
a liaison between the two, and
A god.
a god of their industry, then that's where the problem's coming in. So in order to address, or rather than relinquishing all of the control over to the federal government and entrusting people to make a priority their health care, instead we should have more regulation of the insurance industry. You think that would be a better solution?
I think that the Portability Act has really given a lot of legs to individuals to be able to not be trapped in employment because you're working in a job.
Unless, of course, you have collusion between the various insurance providers, and then
Oh no, think something like that could happen to you.
yeah, well,
You understand that health insurance is a moving target.
yeah,
It's a variable of everybody's health, everybody's lifestyles, how you drive. The best way to stay healthy is choose your parents carefully.
And that's the answer. Choose your parents carefully. Take it up with the big man before you ever come into this world. So, I want to thank Gary. What are you drinking there, Gary? Got a martini, I see, and what kind is that?
Bombay.
Bombay. Excellent.